Thank you so much. Hello everyone, I'm so glad to be here with you. I am Pascale Lofredi, National Secretary of the CFDT Finance Federation, member of the CFDT Confederal Bureau and regional member of the PSI Women's Committee. My speech will focus on decent work for care workers and its interlinkage with the delivery of accessible public quality care services. I will address the following question. Workers providing public care services face serious decent work deficits and many public care services are understaffed. How will investments in more jobs and decent work for public care workers improve the quality of public care services? The aim is to highlight the deleterious causal chain that runs from insufficient recognition of the care professions to the failings of the public service in this field. To do so, I'll say a few words about my country. The COVID-19 health crisis brutally highlighted 10 years of underinvestment in the French hospital system. In a recent report, the Cour des Comptes French Audit Office noted the increasing obsolescence of buildings and equipment as a result of choices made to avoid excessive debt. Urgent financial measures to invest and raise salaries were taken as part of the Ségur healthcare agreements signed by the government and unions as CFDT in 2020 for a total of 15.5 billion euro, but attractiveness is still lacking in the care professions. Human resources have emerged as a major concern. Despite a 2.7% increase in the number of salaried staff in the public hospital sector between 2018 and 2021, plus 0.6% for nurses alone, operating difficulties have increased due to recruitment constraints for certain functions, rising absenteeism, and the growing reluctance of staff to work night or weekend shifts, given the consequences for their private lives. Public hospitals have been forced to resort to expedients, notably temporary staffing and overtime, which have proved problematic and insufficient. The French Hospital Federation makes the same alarming assessment. The public hospital and medical social sector employs almost 1.2 million professionals in France. More than 3/4 are women, and only 25% of hospital civil servants have working hours considered standard, Monday to Friday between 7 a.m. and 8 p.m. Public service professionals have the mission to welcome all patients at any time, anywhere in the country, whatever the severity of their pathology. Their skills and dedication to patient care are the nobility of the public hospital service, but the difficulty of their work also exposes them to a major risk of fatigue and anxiety. As a result, among public hospital practitioners, 30% of positions are vacant, as are 25,000 paramedical positions. This persistent lack of attractiveness is a huge challenge at a time when the need for care and support has never been greater. Rising chronic illness and aging population, not to mention exceptional health situation. Logically, understaffing leads to a deterioration in service quality. A survey published very recently in the French business daily Les Echos shows that the public services which suffer most from a lack of attractiveness are also those which give rise to a degraded view of their quality. Only 45% of some 2,500 people surveyed last December said they had a good opinion of public health, the lowest level since 2011. It's also one of the two areas where the most French people feel the state should focus its efforts. At the end of the 2000s, satisfaction with public health services was close to 90%. By 2023, this had fallen to 73%. This French observation naturally echoes similar findings in other countries, a female-heavy public healthcare sector leading to low wages, hardship, and professional wear and tear that are insufficiently taken into account. The private healthcare sector is no better off for the same reasons. That's why unions must fight to finally obtain decent work for care workers. PSI advocates for rebuilding the social organization of care. That includes also providing public care systems and regulating all actors of the social organization of care, including the private sector. In France, serious shortcomings persist in the provision of public healthcare services. The feminist strike on March 8 was therefore an opportunity to put forward the CFDT's demand for quality public services that meet needs, particularly in early childhood. There is a shortfall of over 1 million jobs in the care and bonding professions and over 200,000 places in early childhood. To end on a positive note, France is proud to be the first country to enshrine abortion in its constitution. The way is open now to fight for its rights all over the world. Thank you.
Thank you, Pascale. Pascale, thank you.